am going to start today by thanking everyone for joining us, everyone on the audience, and our panelists as well today. So this session is a roundtable discussion. I'm going to ask a few questions. Depending on our time, we'll get through more or less, and give a chance for each of our panelists from the various organizations to respond to it as it applies to their work in their area. Before we get into that, though, I do want to mention that and take a moment to acknowledge that our health services across Manitoba are provided in facilities located on the original lands of First Nation, Inuit, and on the national homeland of the Red River Métis. Those of us providing healthcare respect that First Nation treaties were made on these territories, acknowledge harms and mistakes, and dedicate ourselves to collaborate in partnership with First Nation, Inuit, and Métis people in the spirit of reconciliation. And for those of us that were at the last session, really keeping in mind the importance of addiction services and practices and harm reduction as part of that scope of how we can move in that direction. Again, I would like to thank all of our panelists who have joined us today. We're going to go for about 45 minutes of those roundtable questions that I've prepared, and then if we have a little time at the end, we may have an opportunity for some additional audience questions, so you can put that into the question box. We have with us Kate, who is our moderator for this session. I think I've seen Kate. If not, that's probably why you're stuck with me in my horrible use of technology. She's there. Excellent. So with that in mind, I will just quickly introduce our panelists for today. From WRHA Healthy Sexuality and Harm Reduction and our Street Connections programs, we have Dr. Sarah L'Esperance, who is a public health physician and works as a medical officer of health in areas of healthy sexuality, harm reduction, and substance-related health. She approaches her work with a background in equity-focused health policy and focuses on the social determinants of health. With her is Jillian Hill-Carroll. I was going to ask you all for name pronunciations, so if I get it wrong, please feel free to jump in. Jillian is a healthy sexuality and harm reduction coordinator with those teams. She's been a nurse since 2006 and focuses her career on harm reduction, sexual health, and substance use, with experiences in British Columbia and in Manitoba. Her practice is grounded in understanding the ongoing impacts of colonialism on health and the importance of relational, trauma-informed, and culturally safe approaches. Her work in harm reduction initiatives in Winnipeg reflects a deep commitment to equity, empowerment, and collective healing. We also have with us from Sunshine House, Levi Foy. I hope I pronounced that correctly or close. All right, and I believe with you as well as Artemis, who I may have just jump on and add a bit of information. But Levi is a Two-Spirit member of the Couchiching First Nation, who was raised in Treaty 2 territories and formally educated in Winnipeg and Guelph. Co-founded the Like That program at Sunshine House in 2014 and became executive director in 2019. Levi has experience working in research, program development, with a focus on social service administration, harm reduction, and homelessness, and a strong background in community organization that is rooted in Anishinaabe philosophies and practice. Levi's relational approach is inspired by the teachings they have received from Blood and Chosen families. Artemis, do you want to give us a quick note about yourself as well?
Sure, like audio, or do you want me to type it out, or doesn't matter?
30-second audio is great.
Work. I'm from Treaty 2 and Treaty 5. I started at Sunshine House last year. I'm the team lead for our new addictions program that Levi helped start. I have a psychology and neuroscience.
Perfect. Thank you. Thank you for joining us. We also have Trevor Bernelli-Aikman, who's Director of Healing and Harm Reduction at Main Street Project and has been with the Main Street Project for over 11 years. Trevor has an educational background in counseling and emergency and disaster management and currently leads a variety of programs, including the withdrawal management services. With a strong focus on policy development, program planning, and staff training, Trevor works to ensure all services align with provincial withdrawal management standards while maintaining dignified and participant-centered approaches. They play a key role in advancing care approaches and strengthening partnerships with community support such as our RAAM clinics. And he's always looking ways to build a consistent culture of collaboration and accountability. And then we also have Shona Isley, and I hope that was close to correct. I'm seeing smiling, so it wasn't too far off. I had some people help me out. Shona was raised in northern Manitoba in the Pa-Opaskwayak Cree Nation and in Churchill. Her grandparents are settlers from Iceland, Scotland, and England. Residing in Winnipeg, she lives with her husband, who she was her high school sweetheart, and is the mother of 4 children. They are raising their children with Indigenous knowledge and ceremony and work every day to incorporate resistance of colonization and residential school into their children's identity. Shona is the executive director of the Manitoba Harm Reduction Network and has worked in harm reduction since 2000. Her work experience includes working with people who use drugs and are impacted by structural colonial violence. And she works to form the foundation that people, or she works from the foundation that people are the experts in their own life. And through this, working with individuals, communities, and other agencies across Manitoba. So with that, let's jump in with a bit of a warm-up question. So we're all here because we want to know more about your services and how you engage individuals and communities. So could you tell us a little bit about the main harm reduction activities or services that are currently offered at your site? And have you introduced any new or innovative initiatives recently that this would be a chance to highlight for us? So let us start with, because I know there's some new things working over there, Levi and Artemis with Sunshine House. So tell us about the harm reduction services and any initiatives going through Sunshine House.
I don't think it's working, the audio.
Yeah. Levi, I thought I could hear you earlier, but now. Give it another try. No. Okay, we will maybe come back to you guys. And that sometimes gives a sec for the system to reset. Let's go to Trevor. You're next on my screen. So tell us about some of the great work that's going on at Main Street Project.
Sounds good. Can you hear me?
We can.
Nice. So currently, we're developing our intake worker role and position, which we didn't have about a year ago. We implemented it a year ago, and we've really just tried to expand on what resources we're providing for folks who are waiting to attend withdrawal management. Currently, like the reality that we're seeing is we have a consistent wait list of around 80 folks. We're adding around 6 people per day. And so how are we attending to that? So we're working, feverishly to address the concerns around, how we reach everybody within a quick span of time, because there isn't much time. So that's the main goal right now is to focus on that.
It's exciting to, it's exciting to hear about those changes, but also the need to address those large numbers. And so I think that really speaks to some of the situations we're facing here in Winnipeg and Manitoba. So great to hear about those ways to try and address that need. Let's go to Sarah and Jillian next.
So most folks know us as Street Connections. The main harm reduction that we do is supply distribution, both from our site and with 50+ partners. The new thing that we have going on is drug checking, and we've been doing that since the summer of 2024. So that is a service that we provide 3 days a week, Monday, Wednesday, and Friday, out of our office. And we continue to provide outreach services 6 days a week, 5 days a week. We have nursing along in our van.
Incredible. And remind our listeners where you guys are located, that main office for the drug checking.
We're at 496 Hargrave.
Incredible.
So 8:30 to 3:30 Monday, Wednesday, Friday.
Shona, let's hear about some of the exciting things going on with Manitoba Harm Reduction Network.
Great. Good morning, everybody. So it's Shauna Ilsley, close enough. I do answer to Shona or Shohan or Show, so that's all good. So I just want to acknowledge that the Manitoba Harm Reduction Network is a provincial network, and so we actually have 11 sites in the province, starting all the way north from Thompson down here to Winnipeg, and 9 of our sites are considered rural, and 4 of our sites are considered northern. So I just want to acknowledge that, like, we're provincial on scope. And what that means is that although generally most of the work overlaps and looks similar, all of our sites get to respond to the harm reduction needs of their community, which could look different based on the community you're in and based on other services that are available in that community. I'll just take a moment to highlight 2 of our programs, I think. So the first one is that we have what we call peer advisory councils, which are made up of people who use substances and are impacted by colonial and structural violence locally. And those folks then host their own peer-led testing and treatment events, which is intended to increase access to all healthcare and wellness social services for folks who do not access traditional mainstream services due to colonial violence. And so at those events, we offer testing and treatment for STBVIs, including HIV and Hep C. And then, of course, at those events, we also offer lots of supply distribution. I'm always leery when we talk about harm reduction just in the context of supply distribution, because that's a very small component of a harm reduction model. But definitely offering like naloxone distribution, supply distribution, safer sex supplies, and then drug testing options where available. And our newest program linked to that is a navigator program, where we are looking at what happens if we put a navigator to support people to link into care related to their substance use or HIV or Hep C or other STIs, and including other chronic health conditions like maybe diabetes, for example. So really, how do we start to support that connection to those healthcare services for people who, for very good reasons, do not trust those services? And then our last program that I'll just plug is our education program. So we provide 3-day harm reduction training in the province. And folks can find more information on that on our website.
Wonderful.
And I'll pass it over to Levi.
Let's see if we've got our audio going.
Can you hear me now? Oh, it looks like it.
Wonderful.
Wow, I got a green square now. So you're all beholden to me. So Sunshine House is a neighborhood resource center. We've existed for over 30 years. Most of people are familiar with our work around the mobile prevention site. So we're the only sanctioned site in the province of Manitoba where people can consume substances at the moment and receive some overdose prevention services there. That means they can connect with peers. It's if you think of tiers of what supervised consumption services can look like, we're more like a rural nursing station or like a lifeguard station at a pool, as opposed to like a full supervised consumption site. All of those things because we operate out of a vehicle and a parking lot. We see at that service, we see about 600 to 700 people a day who will use those services primarily for picking up supplies. But like Shauna said, harm reduction and the philosophy that Sunshine House uses as harm reduction is really centered around the idea that recreation is prevention. And so if we give people things to do and we give people a place to be and we give people a place to kind of hang out and define their space, that's doing a lot more, or that actually adds to keeping people safe within our community. And that philosophy really guides all of the programs and services that we do. I'm not going to go into all of the programs and services that we have at Sunshine House, but everything is harm reduction focused, and we're a Two-Spirit and Indigenous-led organization. And when we're operating in full scale, we see about 1,000 people a day. Artemis is running the Bamoseda program, and I will let her kind of take it away from here and kind of let you know all about the really, really interesting work that's happened there and all of the partnerships and stuff that have been developed.
Yeah, so this is a program that started December 1st of last year, and its goal is to help community members navigate addictions and withdrawal management services, whatever that looks like, specifically 2S LGBTQIA+ community members. And the focus for that is just because there's a lot of, as I'm sure we all see in Manitoba, things are very binary. There's not a lot of support for queer people, and substance use is tied very much in a lot of the lives of queer people. So we kind of just help them navigate and walk with them, whatever it looks like for them. If they want complete sobriety, or if they want to, go on a managed program or reduce their usage, whatever it is, we kind of, me and my team, help navigate and help do.
Incredible. And actually that leads very well into what was going to be my next question, although folks have started to touch on it already, but curious about what are some of the ways you guys have helped participants navigate various barriers that they may face in accessing support. And Artemis, I'll start with you, because that was actually a dovetail from your program specifically. So if there's anything you wanted to add to that, how we're ensuring folks can access us and navigate all the various barriers that occur within our province.
A big one here is just kind of collaboration. So like Trevor, I know, because like we've worked together to help streamline and kind of help people, maybe have a bed or like provide additional support while they're in, detox. And for me and my team, the best way we've noticed is kind of just, collaborating, making connections in the community, because we're all kind of tied together in different ways. And it just, community like makes everything work better, easier. Yeah.
Thank you. Since you tagged Trevor in, Trevor, is there ways that Main Street Project has been working to, again, help participants navigate some of the barriers to accessing your services and harm reduction within the province?
I mean, specific to detox, we're connected to St. Boniface, we're connected to HSC, as Artemis mentioned, Sunshine House, we're working on that. We're heavily connected through RAAM, so through the province through CRC. We had evacuation beds specifically this summer. It really depends on what the need is right now. We pivot a lot and respond to whatever folks are needing, and so we're pretty adaptable. If we need a justice bed and someone's coming out of wherever, we're open supporting. And just speaking to detox, so we have several other programs that are very connected to Street Connections, or to Sunshine House themselves through maps, or yeah. So it really depends on the day.
But I hear that importance of that collaborative connection, and knowing other agencies and individuals in the community. Shauna, what about with Manitoba Harm Reduction? What are some of the things you guys are working on across the province to help reduce some of those barriers? And I think you spoke to just location, but curious your other thoughts.
Yeah, so one of the big things we do is we facilitate local harm reduction networks. So we have 11 networks throughout the province as well. And those networks are made up of service providers who work locally with populations of people who use substances. And the intent is to increase capacity within those networks to do harm reduction, but with the hope that they take that back to their organizations to increase capacity locally. And we have been around, the Manitoba Harm Reduction Network has been around since 2002, but the networks, like one of our networks is Play It Safer Network, which is in the Pond Flin Flon area. And that network has been around long before that. It's been around for a very long time. It started as the AIDS Coalition up there, the Northern AIDS Coalition, I believe it was called. So they have a long history of that kind of collaboration. But just to highlight, those are only as successful as the folks who are part of those networks, and that includes collaborating with and working very closely with local tribal councils or non-affiliated communities and other Indigenous harm reductionists. And I know there's limits to a panel like this and the number of people you have, but I think I'm the only organization representing a provincial scope. I just want to acknowledge there's some really amazing harm reduction work happening in rural and remote Northern and Indigenous communities in the province. And often it is being led by one or two people, which is a really big ask for people to carry in small communities, especially where there's still some misunderstanding of harm reduction. So I just want to acknowledge that. But the other really big piece that leads to the success is having local people who are hired to do the work, who are connected to the nuances of the communities. And that includes ensuring that all of the work is peer-led and led by people who use substances. I don't even know if I answered your question now. Hopefully I did.
That was wonderful. Yeah, that importance of having peers, but peers that are advocates in their area and know their communities. And we do, I will give a little shout out to, we have a presentation I believe it's in 2 weeks, where we have some other agencies doing some of this work more provincially, but absolutely today you are definitely carrying a lot of our provincial scope. And so it's, again, important to think about that, not just within Winnipeg, but across our whole province. Sarah and Jillian, yourselves, what are some of the things that Street Connection is doing to reduce barriers to access to care?
Yeah, thanks. There's a lot of things we try to do to really enhance connections, and that's a lot of what many of us are speaking about today is one of the primary ways to reduce some of those barriers. Making connections with the community, whether it's through community consultations or with partner agencies in Winnipeg, are some of the ways that we try to do that. I think in effect, what we're often trying to do is sort of get out of the way and to support others and to support community members in recognizing their direct link to the community and ability to share resources in ways that may be enhanced or unique to the needs of each community. And so that's a lot of what we try to do, and to some degree is almost get out of the way, as I say, and provide supports. In addition, some of the ways we look at reducing barriers is collaborating in terms of how we can provide connections to care. And some of that you'll see most distinctly in the work that we do in the area of sexually transmitted and bloodborne illnesses. I know, Jillian, you could speak a little bit more to some of that work that we're doing in collaboration.
So in Winnipeg, about 1/3 of folks that are newly testing positive for HIV are folks that have tested through our office or through the Street Connections van. or through the outreach work that we do at the Remand Center, which speaks to how disconnected folks are from the healthcare system for really good reasons. And so a big part of what we are trying to do once we've tested folks, or even if we haven't tested folks, is provide a bit of a buffer to support people into the mainstream healthcare systems. Either going with folks, we have 24 public health nurses and 4 outreach workers. So trying to leverage them to connect folks into Manitoba HIV program, support to the Minnepamatsuan Sexual Wellness Lodge with the aunties there to help move people into healthcare in a good way. I will say we do lean heavily on our community advisory group that meets once a month to dictate how our services are provided. Our Street Connections van, how and where we move through the city, is absolutely influenced by where we're getting calls to and where we're seeing communities. So we are trying to respond as much as possible through our van. And then also try to create partnerships in areas where we're seeing lots of demand for our services. And so trying to build up more brick and mortar supports within those communities.
Thank you. And yeah, that again, that collaboration, and at every level, right? That there's lots of creative and innovative things from the voices of people who use drugs all the way up to our system administrators, from that brick and mortar to Levi and Sunshine House. I now am picturing a lifeguard stand in a parking lot. Which I think is an incredible way to kind of picture the range of what we're doing to meet people where they are at. With that in mind, curious to hear what kind of feedback you guys have been hearing from people who use your services, their families and loved ones, particularly given some of the new care and initiatives that are starting, and how has this shaped some of your harm reduction practices in recent years? So let's start. Shauna, let's start with you for this one.
So I don't know if I understand your question. Can you say it again?
Sure. So what kind of feedback are you hearing or input or ideas from the people that are using your services? And how is this shaping the harm reduction programming that you are offering?
So this question is really simple for us. We are peer-led, and so all of our sites, it's peers and people who use substances and are impacted that direct all of the work of our local coordinators. And so what is it that people who use drugs in rural Manitoba need, and in particular communities need? They're the ones that shape the response in that community, primarily focusing on improving access to healthcare and social services for folks who use substances. We know that in rural Manitoba, access is quite limited. Even if we, for example, think of a RAAM clinic, out of our 11 sites, only 5 of them have a RAAM clinic, right? So we still have 6 sites where there's not even access to rapid addictions medicine. And so really, the other thing to note is that when you work with people, and Levi and folks at Sunshine House can attest to this, but when you work with folks who experience, maybe I'll say, when you work with folks who are on the hustle every day for survival, it's really about addressing their immediate presenting needs. And sometimes that has to do with their substance use, but most times it doesn't. And what we know is that substance use is a really great harm reduction strategy for folks who are living in quite volatile and maybe violent situations. And when I say violent, I don't mean from each other, I mean from systems. So how do we do it? The feedback we get constant feedback on what needs to happen in the communities. And a lot of our work is really about advocating to improve access to those things or help to build those things. Even if we think of the RAAM clinic, the Selkirk Peer Advisory Council was one of the peer groups that was consulted with the Virgo report, which ultimately ended up with Selkirk having a RAAM clinic. And then that group continued to help frame the development of that local RAAM clinic. So yeah, hopefully that answers your question. It's about being peer-led for us.
And I think so important. And also when you mentioned where, sometimes we think, and someone earlier mentioned, we sort of think of it as just the supplies. But it is actually such a larger picture, including, all those other needs. And, sometimes a warm meal is a way to support and connect with folks. So, and again, doing that in ways that reach at local levels. I think that's important, and I appreciate you sharing that. Sarah and Jillian, we'll go to you next. What are you hearing in terms of feedback or requests from participants, and how is this shaping your programming?
I would love to say that we're able to be super responsive and peer-led, and we do try to incorporate as much feedback as possible into our programming, and also recognizing as a WRHA public health team, we have significant constraints. I think the big one that we're seeing is a real shift in substance use trends from injection drug use to smoking. And that is, I think, one of the biggest pieces that we get from community is wanting more smoking supplies. And because of budgetary restraints, that we can only provide what we can provide. So that is a piece of frustration, but a piece that we do consistently bring back to the province. Our drug checking services were a direct result from community requests. So we were thankfully able to respond to that. But I would say pivoting on what supplies are being requested from community is a big piece that we're seeing. Additionally, I wish for a safe consumption site. And so in our roles at tables that we're setting at, we are advocating consistently as much as we can that is something that is required.
Yeah, I agree. And I think it really speaks to some of the feedback we've heard through our community consultations with individuals who use our services. As you mentioned, a lot of interest in drug checking services initially, and that was a strong impetus behind our team working to implement a drug checking system here. Certainly, we've heard a lot of requests for the SCS and support that move towards an Indigenous-led supervised consumption service, specifically here in Winnipeg, although it's definitely needed across the province. And so hearing those voices and, as you mentioned, really trying to continue lending our support and our voices behind that in support of what our community is asking us for. Again, I think, Shauna, as you've mentioned, really that recognition of all of the other needs that individuals face and experience, and trying to find ways to pull in connections to supports. The barriers are huge in terms of us having easy access to housing supports or other social services supports for the people that we serve and support. And we really recognize that that's kind of the primary harm reduction intervention that we could potentially, facilitate or support. But again, we struggle with those barriers, as I'm sure many of us do, and try to find creative ways to overcome them. So.
Absolutely, to hear these great things like the drug tracking and being able to be flexible in terms of trends and distribution for supplies, but that there is still so much work to do, and the collaboration sounds strong within our services, but how do we even then connect to other areas that don't necessarily think of themselves as part of this work, but are definitely important to that holistic picture for folks. Levi and Artemis, yourselves, what are you hearing in terms of feedback and trends and requests from the people using your services, and how is that shaping your programming?
So for us, so one of our roles within the landscape when we first published the supervised consumption site report back in 2019. And then through the next couple of years, one of the roles that Sunshine House really just was directed to take through the peers that were engaged in both of those processes was to be kind of the mouthpiece for these things, particularly around supervised consumption site, because nobody was really taking it up. People were taking it up, but it wasn't public. People weren't. There was not a lot of engagement that we were really seeing. And particularly around like rapid response, because that's the one thing that as a smaller agency at that time that we were able to do. So as a result of that, we're really, really public with a lot of our services, particularly related to supervised consumption spaces and overdose prevention services. We've had to apply for the full exemption, and that's a whole other conversation. And through that, we had a community consult, and our community consult around permanent supervised consumption services in a mobile capacity was overwhelmingly positive. I can't remember the exact stats. They're just kind of finalizing that report for public viewing, but we like the overall response that we received was really, 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 really positive, and in a lot of neighborhoods in Winnipeg, and then in neighborhoods outside of Winnipeg, and then in neighborhoods that we didn't think we would have that type of response for. So that's been really, really, it's been really great. We also, like as everyone else has mentioned, like Sunshine House is, like Shauna, we are really, really, we are really, really intentional about what we mean by when we're saying we're peer-led. And so we make sure that peers are engaged in all of these processes. We're also kind of a unique organization in the sense that we have, like over half of the staff that work at Sunshine House were people who were participants in programs and services before. And so that makes things really, really unique because we have that kind of direct connection to living experiences. And we've just restructured our governance structure within the organization to ensure that peer voices have just as much of a say as traditional board of directors. That's all I'm going to say about like the feedback loop that we have, because everyone else has kind of captured certain things. And then I'll let Artemis kind of talk about some of the feedback that she's received from participants and stuff in the program.
Yeah, so just because the program's so new, I've heard really positive things from everyone. Obviously, like substance use and people's decisions around that isn't necessarily always people aren't always in a good mood. But I've just heard, like through my work and my colleagues' work, just lots of people like just really happy to also just have, because the entire team here, we're all two-spirit, so it's sometimes even if it's just like coming down for like a visit, like at the like Bruce Oak Recovery Center, and just kind of having like a very like just queer conversation with someone who's in there kind of just means the world to them. So I've had a lot of really positive response, and people like, oh well, I'm really, really happy that I had this kind of connection because I never thought I would. So
that I hear that connecting with the individuals directly, but also not just hearing the voices, but amplifying the voices and being able to carry it for when folks, for any reason, whether it's stigma, whether they just don't feel their voice is loud enough, that we can take that and support that. Trevor, what about for yourself and your agency? What are you hearing in terms of recent feedback and ideas, and how is that continuing to shape your programming?
I think it's interesting, and having been here for 11 years, it's definitely changed. There was a really big shift about 5 years ago when we had different leadership take over, where it's like we're actually going to do something and not just have programs that exist, where people come in and they just really kind of do nothing, and really kind of gain nothing, and there's very little support and all that. With the program that I inherited, my former coordinator and I, like we gathered as much feedback as we could and tried to bring back as much as we could to establish continuity for the participants who are trying to access. And like I mentioned earlier, like bringing, the intake worker back in and building policy up and understanding that we're needing to give folks bed dates as soon as they try and contact us. So we're consistently trying to bring a new spin on the work that's happening. Like we're currently working on, handbooks and programming handbooks for folks when they come onto the unit, more of a structure around our casework support that gives resources like on the spot in those sessions. And I was just writing down some of the recent feedback that we got was, doing hourly sessions on nutrition. A mental health resource contact session is something that we're also working on. Hygiene and self-care session as well. Naloxone kits being provided on discharge. And we also, about 6 months ago, brought a marriage and family therapist onto the unit. So, we have somebody there for 2 hours every week who does some good group work with folks. We also have, we don't have funding for our intake worker positions, and a lot of that comes out of donations. But a portion of the work that our intake workers is doing is connecting on discharge. So are there any supports that folks are needing after they leave the program? Do we need to support in any other way to, access to other programs that we have? It's really, it's a daily, evolving. I mean, it's a Main Street project. We're responding to small crises. I'm sure other places are every day, and so we're it's all over the place. But we are trying to focus on like, what does 14 days look like? What does one day look like for someone in terms of being successful in withdrawal management? So it's constantly evolving.
Incredible, and again, lovely to hear about that. There's sometimes our real practical pieces, and I'm old enough to love a printed handbook when I'm learning and reviewing things, but also those little, right, like how do we do nutrition, how do we do connection to the wider community, to people that are going to support us. So I really appreciate hearing about that, just those innovative ways you found. Sometimes it's a little push, but that can make such a huge difference for folks. So thank you. Okay. Oh, looking at the time, my goodness, this is going so quickly. Although I do love the kind of synergy. You guys have covered a lot of my potential questions throughout all your responses. So I'm going to give us one last sort of formal one for the group, and then we should have a few minutes to take some additional questions from the audience. So we've talked a bit about who you are, where you've been, and so now where are we going? So looking ahead, what opportunities do you see to strengthen or expand the harm reduction work you're already doing, whether through new approaches, partnerships, or areas of focus? So basically, what does the future hopeful, or if you can share some new things coming, that's wonderful as well. But what does those opportunities to strengthen the work that we're doing look like for you and your agency? So where do I even want to start? I feel like I was starting the correct rotation, and now I've forgotten who started and who's not. So you know what, we'll start with Sarah and Jillian first.
We got a list of the questions before, a rough list, and I think I was very aspirational in a best case scenario, what I would love to see that would help move work forward in a good way. So my answer is maybe not based in reality so much as my hope for what I would like this work to look like going forward, which would be very much provincial initiatives that were evidence-based and community-driven, or evidence-based in communities that were using the services driven versus communities that didn't want services. So having best practice initiatives versus general public opinion directing practice, having safe housing options for folks, having safe supply as an option for folks, easy to access safe supply for folks, having addiction services be health-based versus carceral. Those are the things that I was wishing upon for the future. I'll see if Sarah has a more grounded thoughts.
No, it takes all of us together, right? I totally agree with all of the things, Jillian, you've spoken about. And I think, I think one of the things we are hoping for is just trying to find better ways to be integrated within systems that are working already here in Winnipeg, and being, helping to find ways to connect our folks that we see at Street Connections into the other great programs and services that are happening that everyone's speaking about today. Ideally, I would love to see that we have better linkages to, in low barrier ways, to many of the supports and services that people are asking us for, whether that's in getting, HIV treatment or care in a way that also addresses social contexts and barriers, stigma, racism, all of the things that get in the way of many of our social services and even health services feeling like insurmountable barriers and unwelcoming to people. And so to me, ideally, it would be a system where the philosophy of harm reduction and the idea of meeting people where they're at is infiltrating almost all of the ways that we provide services in Manitoba. Again, just as lofty of a dream as Jillian's, but ideally that's what I'd love to see.
Awesome. Thank you. And I think so important to have these dreams and again to continue to amplify those pieces as we move forward. Okay, Shauna, what about you guys? What is those opportunities coming to strengthen the work that you're doing?
So I think I want to angle this less about like what's coming and more about like what we are going to continue to advocate for. And some of it's already been chatted or stated, but housing and housing first models to care versus treatment first models. We know housing first models are astronomically more successful than treatment first. And of course, all of this I'm thinking of and presenting in a lens that governs the whole province, not just houses in Winnipeg, but houses everywhere. Safe consumption sites and services throughout the province, safe supply to reduce our drug poisoning deaths. And I just want to add that for us at the Manitoba Harm Reduction Network, this includes non-medical safe supply, and it includes safe supply for everybody, not just people who are experiencing substance dependence, which is typically when we talk about safe supply who we're looking at. Everybody should have a safe supply, even 17-year-olds who are buying from an illegal market, like everybody should have a safe supply. So we'll continue to advocate for that, advocate for increasing access to supply distribution. We need to disrupt HIV and Hep C transmission. We are #1 in the country. We have the highest rates of HIV and Hep C in the country right now. Building and integrating Indigenous science into substance use services and treatments. We know that culture is intervention in problematic use, and it's also prevention in problematic use for young people. And so how do we rethink treatment models, and how do we rethink and ground substance interventions in connection and rooting people back to the land and culture? I have two more. Transitioning from fear-mongering education to evidence-based education for youth on substance use. I think the evidence shows that would go a long way. And then ultimately, the big dream is to abolish harmful systems and build new ones that are not grounded in oppression and racism. So lots of really big asks, but those are the things we will continue to advocate for over here.
Definitely, and big but important asks. So thank you for sharing those. Trevor, thoughts for you guys in terms of opportunities to expand the work that you're already doing, or even more generally for Manitobans?
Well, I right off the top, more bed space. I'm hearing from our intake staff, and I mentioned the numbers earlier. You know, we could probably fill up a good portion of the convention center in one day, you know, based off of how many people are needing access to treatment right now. Access to, you know, even just the 14 days that we provide. I don't know how much of a rant I want to go on here. But you know, less carceral was mentioned. That's a big one. Safe supply. I mean, there's proven systems in European countries. You know, it's just I'm frequently lost on how I don't want to get into the politics of things, but you know, there's certain things that have been said and then we just kind of don't toe that line anymore or whatever, you know. I think we need to continue to stay connected and continue to speak out. I know there was a recent public forum where someone was saying that, you know, the war on drugs worked. I really had a good chuckle at that, but I'm sure like there's some deep concern among the, you know, the folks here in this session here, that our voices aren't being heard, or but we need to continue to stay connected and continue to speak out and use, you know, social media platforms to show the work that we're doing in respectful ways, and understand the work that we're doing, and for the folks that are listening, you know, to ask more questions, even outside of the scope of this session. So
awesome. That we have so many wonderful, incredible services, but I think, yeah, sometimes we're just too darn small. And so whether we're amplifying bed space or amplifying our voices, doing that together is such a powerful thing. Artemis and Levi, thoughts on those opportunities coming your way to build on the great work that you're doing?
I can speak on like my little program because it just started, so I'm just kind of hoping that it continues. But also, I've been working a lot with a lot of organizations and kind of just like planting those seeds and hoping they flourish next year. Because I know there's a lot of upcoming addiction programs and centers and second stage recovery living spaces that I'm kind of hoping, you know, can get to that point so that we can also walk with them and kind of join and kind of help out as much as needed. So that's kind of my hopes, is just kind of continuing along and kind of hoping more opportunities for addiction resources kind of become available and we can kind of work in more collaboration with each other.
Absolutely, for yes, your program to continue and grow, and then those connections, so important. Levi.
Well, I think again, you know, like the realistic thing is, I kind of want to retain my staff all the time, and I want people to have jobs, and that's very, very difficult in this landscape. So it also makes planning for the future really, really difficult, because like Artemis said, like, you know, that project that employs 3 people that are doing really, really tremendous work. Probably the reality is, you know, in a few months we're gonna have to make real hard decisions about, does this exist? And not only that, it's around MOPS, it's around all of our programs. So that points to a larger thing of just like really, really investing in projects that work, supporting one. Like I would really love to see more support. You know, Jillian had mentioned, you know, they don't have resources for inhalation supplies. So that falls on us as the overdose prevention site. So we spend about $6,000 a month on supplies alone. And so if I had $6,000 a month, that's 1.5 to 2 staff I could have a month. That is 2 more peers I can hire a month. That is dollars that can be used for resources to get people to, you know, so I wouldn't have to scramble to try to find an Uber or a taxi to get someone to their intake appointment to get them into detox that day because they're ready to go. All of these things would be really, really useful. You know, in a greener pastures type of sunny days kind of world, it would be really nice that we didn't have to do this work. It would every day, like the philosophy that a lot of us have is wisdom that was shared with me by one of the elders I worked with in child welfare when I was working in that sector. And he said, every day, Levi, you have to work yourself out of a job. Do something where you're not going to need to do this job tomorrow. And that's the kind of philosophy that we have imparted within the organization. And so that's the goal, is to be building people up and to giving people the proper supports that they need. But it's it's impossible when EIA rates are what they are, when there's no housing supply, when there's no pressure, when pressure is being placed on us to be doing immaculate jobs, but we let developers and we let people with money and resources just walk roughshed all over our communities. Absolutely impossible. And finally, I think, as Shauna was saying, I think we ideally for the future, what I would love to see is I would love to see all of the drag artists that work here being able to be paid to do the work that they actually love, and not doing this and being able to bring their gifts fully to the work and everyone be able to bring their gifts and share their gifts in a better way, and be working in an environment where, that we're currently working in. I think we really got to revisit everything that we're doing right now, because policing and prohibition are absolutely piss poor public health policies. And I think that there needs to be a lot of really rethinking about how we're going to do this, because substance use is not going to decrease. It's only going to increase because of climate anxieties, because of the economic realities of this world. And I think we're doing a really, really crap job of planning for it.
Thank you. Yes, the dream to work ourselves out of a job would be incredible, but in the meantime, so important to build and strengthen, support everyone that is working in the system, accessing the system. Really appreciate those thoughts. Oh my, okay. I had one question. We almost don't even have time, but I'd be curious, just almost like a popcorn round. There was a question about bringing some of these practices in terms of harm reduction and principles. And Jillian and Sarah talked about, like, as an entire system having these things. How do we bring them in particular to emergency departments and urgent care centers? So ways that we can make that successful in what is sometimes the most formal wing of our system. Any quick thoughts on incorporating some of those places into those trickier settings? And I'll open it to whoever wants to give a response or share an idea.
I'll jump in really quick just because we have a little bit of experience with this, but one of the key things is people who work in those departments have to actually understand fundamentally what harm reduction is, because lots of people just think it's about supply distribution, and it really is how we provide care. But also, our emergency rooms are one of the most important places for us to get grounded in harm reduction, because people who use substances and are impacted do not access traditional Western mainstream services until they're going to die, which means they show up at emergency rooms, and the evidence shows that is where they are treated the absolute worst. And we have people who every day will tell us, I'm sure MOPS hears it a lot, that they would rather die than go to the emergency room because of how terribly they're treated. And so we absolutely must get it integrated into emergency rooms, but that comes with, like, fundamentally people have to understand and do some training about what harm reduction is. And I want to say there's also really great people that work in the emergency room. That's not what it's about, but we know the system creates the violence, not necessarily the people who work in that system.
Changing that entire culture there. Sarah and Jillian, quick thoughts.
Just to very quickly piggyback on what Shauna had said, that when something is put into a policy, if you're adopting a harm reduction policy, that it gets held to the same standard as, say, supplying medication in a good way, and that if you are consistently not giving medication correctly, you're going to be reprimanded. So having expectations of practice and then people being held to those expectations. If it's presented as optional, people will treat it as optional.
Great point. Okay, we are a few minutes over time, and I want to make sure that we can get all of our incredible presenters today back into the good work that you're doing. Although sharing your knowledge and your insights is so valued and so important today, and helps move that public and general education forward. So thank you so much for your time. So greatly appreciate you being here today, and thank you very much for sharing these thoughts. I hope everyone takes a moment to reflect on those key ideas that were shared. across these wonderful different groups and individuals with us today. So on that note, thank you everyone, and again, please join us next week for 2 more exciting RAAM KE days. The registration links are in the posters that were sent out. Thank you and have a great morning, everyone.
Thanks.